Hello runners, welcome to Common Running Mistakes. My name is Dr. Cameron Garber here with Dr. Mark Humbert. We're from Body Smart and we love to bring you some of the tips that can help keep runners on the road. So our common running mistake for today is related to low back pain. And when people have back pain, they often make this mistake, and that is that they
stop moving.
Exactly. They stop moving. One of the best things you can do for low back pain is to keep moving, keep running. Even if it hurts, it's not doing additional damage most likely, and will actually be one of the fastest routes to you resolving your back pain. In fact, one study showed that the best way to get rid of low back pain long term is actually get on a progressive running plan where you start running where you can, where it's not increasing the pain, and you just run a little bit more and more and more until the back pain goes away and stays away. It's not the most pain-free way of getting rid of back pain. It's a little more uncomfortable, but it actually, at follow-ups, so like 6, 12, 18-month follow-ups was the most effective at keeping back pain away. And my theory there is it probably just improved their overall health more than any other way of getting rid of back pain. And so they stayed more fit, healthy, active, and so the back pain stayed away.
I think one thing that we've got to remember is that backs are super resilient, right? With all the ligaments, with all the musculature around there, it's a very strong, stable structure. Sometimes in the healthcare world, we get some kind of unfortunate language around back pain, right? That's very demotivating. It decreases people's beliefs in themselves that they can get better, and often gets them too dependent on quick fixes or on people or practices that are going to fix the back pain. And so I think that's the thing that we've got to remember. And I think also we can take a second to dive a little bit deeper into what pain actually means. So we know that sometimes that pain is an indicator that like something is damaged, right? Like you jump off that 30-foot cliff and you land on a rock, right? Your leg's broken. I think we can pretty well equate the source of pain.
Right.
But for many other things, it's not that simple like input, output, right? Pain is much more complex than that. And there's not always this pain equals damage. Often pain is just kind of a warning sign to get us to pay attention to that area.
Right, and pain doesn't mean you're broken. Just because it hurts doesn't mean we have to stop moving. In fact, it's usually the opposite. Pain is your body's way of telling you, hey, I need you to strengthen this area because it's hurting. Right? Because there's something going on there, so let's strengthen it to make the pain go away, not avoid all movement, and then the pain actually tends to get worse or stays around for much longer. So a lot of the language that we use is, it keeps us in this pain and fear of pain cycle.
And I love that fear, right? We begin to like catastrophize is the word that they use. Movement and doing the activities that we used to do. And then that just allows us to do less and less and less, which is really unfortunate.
Right. And they have found that the sooner you get back to activity, the faster your symptoms will clear up and your pain will resolve. So get moving.
And so I think a thing along with that is that's why it's great to go to someone that's qualified to take a look at the things that are going on and give you the best advice. What's not going to help is going and getting a bunch of images of your back.
1 in 2,500 x-rays, only 1 out of 2,500 x-rays, unless there's a fracture, correctly identifies the cause of pain. So like the x-rays are terrible at helping you decide why you have pain or learn why you have pain. So that's not the best route, only if we suspect a fracture, but go see somebody first and see if we suspect fracture. Because here's what you will find on an x-ray. You will find some arthritic formation. Everybody has it. Everyone. You will find some disc degeneration. Everybody has that too. If you have had an x-ray and they tell you those things, guess what? You're 100% normal. Everybody has those. It's like wrinkles on the inside, right? So don't be concerned when you hear that type of thing. That's very, very normal. So I would say that is kind of probably the second most common running mistake. First being people stop moving. The second is they wait too long to get help, right? Not going in and getting help from a qualified professional that knows about running, for one, and two, really knows back pain. So honestly, this is one where I would skip the general practitioner and go right to a physical therapist. With low back pain, they have found that if you skip the middleman, so going to a surgeon or the general practitioner, you actually shorten your course of treatment by a ton. You save about $6,000 per episode of care, and it usually takes only days to weeks to resolve it instead of weeks to months. So go in, get help right away as quickly as you can for your low back, and keep moving. If you find a physical therapist that tells you to stop moving, I would go find a different physical therapist. Because honestly, the best thing you can do is to keep moving and preserve your motion and strength and everything. So those are kind of your two common running mistakes and the best tips you can do to avoid it. So make sure if you know somebody that has low back pain, share this with them. If you have low back pain yourself, definitely seek help. If you're within our area, we would love to see you. If not, seek somebody out. If you need help finding somebody, let us know. Reach out to us and we'll help you find them. Definitely make sure to like, follow, subscribe, all of those good
stuff.
Yeah, so you can get our next video, so you can get the help you need to stay healthy and on the road. That's what we love to do here at Body Smart. So thanks so much, and we'll catch you on the next one.